There are certain medical conditions that exist amongst families that people have failed to pay attention to. That is what we'll be talking about today. Hello, thank you for coming back to watch my videos. If you're seeing my face for the first time, my name is Chidima. I'm a registered nurse. I live and practice in the United Kingdom. So today, without wasting time, we'll be talking about certain family medical histories that people have neglected and plays a major contribution to the outcome of their health maybe in the future. So one of them on the list for today is diabetes. So we know that diabetes is a very popular medical condition. A lot of people are suffering from it, and it is one very medical condition that is very difficult to deal with, especially when you do not have the right financial status, you do not have the support of the government regarding primary health care, then it becomes very challenging to deal with that. If in a family diabetes existed, when I say existed, I mean up to 3 generations back, then you need to pay attention to that. Whether you're a woman, whether you're a man, you need to pay attention to that. For women, sometimes these things have resurfaced in their life as young people when they get pregnant. There are so many women who have developed diabetes in the course of pregnancy and it resolves after childbirth. And for some people, it doesn't. They even go to the point of having to depend on insulin. And from my experience in the labor unit, most of them that have come in contact with have history of diabetes running in their families. So this is why if you have any member of your family suffering from diabetes, then you need to make amendments to your lifestyle. It's very important. Because the earlier you begin to eat the right things, do the right things, the better the outcome. Even if after doing all of those good stuff and you are diagnosed diabetes, it's very easy for you to manage because you have already gotten yourself acclimatized to that lifestyle that will help you cope with that medical condition. Now, if in a family glaucoma exists, then you need to pay attention to it. If you go undiagnosed, walking about with eye issues, then you also stand the chance of having this affect you because it's running in the family. One thing is knowing that these things run in the family and making amends to your lifestyle. Another thing is knowing it and living in denial. And another thing is not even knowing that it's existed in the family until it happens to you. For people that have the history of hypertension, that is another very important one that you need to pay attention to. Hypertension is known to be a silent killer, and I agree with that because so many people are moving about in the streets, living their life, doing their stuff without knowing that they are hypertensive. And that is why we are encouraged to go and check ourselves from time to time. Walk into the clinic, do your blood pressure check to be sure you are fine. That is why you hear people, they say they just had little moment of headache and that was it. They passed. That is why people suffer from cardiac arrest without knowing. So if you have a family member that has hypertension, paternal, maternal, you need to pay attention to your health. Eat the right things because if you have history of hypertension, then you need to pay attention to the kind of food you eat, bland diet, reduce the salt intake, and all of those things, cholesterol and all. So you need to pay attention to your body if there's a history of hypertension. And do not hesitate to tell your GP, the family doctor, the hospital, whoever you meet in the professional line in the hospital, break it to them to say that we have the history of hypertension in our families. It's going to help them be very quick to decide what is happening to you should you have any strange thing happening to your body system and you come to the hospital because they have it on their record. Another thing is something like sickle cell disorder or sickle cell disease, I mean. So you need to pay attention to that as well. This is especially for young people. Many of us live in denial when it comes to sickle cell because of the word love. Some people feel that, oh, love can change anything, love can make you bear this, love can do this, love can do that, but not in the case of sickle cell. We know that if two people having AS come together as partners, they develop these things. It's everywhere. It's not a new information. It's everywhere in the internet. People are being made aware of these things. But because we fail to accept them, that is where these things occur. You don't want to give birth to a child that will be languishing in pain every time, a child that is going to make your life, let me use the word, miserable as well, because everything as well will change for you. You might be skipping jobs, you might be keeping videos at night. So many things can be frustrating for you. You might be walking in and out of the hospital because of this health challenge of this child. So you need to pay attention to that detail. So if you have somebody as well who has suffered stroke in your family line, then pay attention to that. You need to pay attention to that because sometimes these things appear like it's handed down from generation to generation. Even though there are so many things that can make you have stroke without it passing through the family lineage, the kind of life you live can predispose you to having a stroke. In fact, for all these medical conditions I've listed, your lifestyle is a key thing to some of these things. The much attention you pay to your body is also a determining factor. Some of us from year to year do not get ourselves checked out. We're just too careless with our bodies. We don't pay attention to the signs our bodies are giving us. These things can predispose you to have all of these medical conditions, even if it does not run in your family. Another thing is cancer. So for women, there are certain kind of cancers that appear to be handed down from families to generation to generation. I mean, the likes of ovarian cancer, breast cancer, and all of that. And just a few do not appear like that. So if you have a family member that has suffered from breast cancer, then you need to always do your breast check, the mammograms, and all of those. You know, check out for lumps every single time after your period to be sure that they are not there. And if they are there, you need to go and get a biopsy done to rule out if it's cancerous or not. The earlier, the better. Early detection is always the first line of action for every medical condition. Anyone you detect on time, management is always easier. Then for the men, you need to be on the lookout for history of prostate cancer. You need to be on the lookout for that. So if there's any member of family that existed in the past that had prostate cancer, then you need to go and get your prostate checked out from time to time. It's very important. In fact, let me use this medium to tell us that for ladies, we need to always make sure that we go and do our cervical cancer test screening or test or screening, whichever way you see it, every 3 years. I think here we do it once in 3 years. You need to have it done so that any tissue that tends to show signs of, all of those things will be dealt with different kinds of treatment options that are available. The earlier, the better. And for the men, you need to have yourself checked out. So we need to form the habit of doing our routine medical checks in order to be able to do or dictate these things on time. And even if we dictate them and they are there, we need to also make adjustments to our lifestyle. I know that these things are difficult to do because you don't learn certain things at an older age, but if you're determined, you'll be able to make the necessary change. This is where I'll be ending this video today. Thank you very much for watching, and I'll see you in my next video. Make sure to subscribe, like, share, and comment, and turn on the notification bell so that you will be aware of when I post a new video. I'll see you in my next video. Bye.